patients will call me and ask me how Rosellen and Dr. Hammond's day is going, because they really, really enjoy them, as do I.
My name is Natty Hammond. I'm an orthopedic surgeon. I specialize in shoulder and elbow surgery. You know, I would say my practice is already very specialized within shoulder and elbow surgery, but I would say even within that, I have a particular interest in shoulder replacement surgery. Much of our research endeavors have been devoted to bettering shoulder replacement functional outcomes for patients. And so I find that to be of particular interest, and much of my career and my research studies have been devoted to shoulder replacement. Well, I would say the most important thing in providing patient care is a good relationship with the patient. And that begins as soon as the patient walks in the door to the building. That begins with good staff, good nurses, good physicians, good therapists. And so it's really a collaborative effort we take here to ensure that patients have a good overall care when they come to Ortho Carolina.
Dr. Hammond is probably one of the greatest surgeons that I've ever come across. He's very intuitive with his patients, whether they come in for a simple elbow aspiration or bursitis all the way up to a total shoulder. Each patient is always treated equally with his time. He always makes sure that the patients go out with a clear understanding of what their process is and what to expect at the end and what the goals are for their recovery.
Dr. Hammond is one of those types of guys that he really gets into his patients. He knows what you need. You know, like with me, I came in and I wanted to rush everything, and he really slowed me down because he was like, you know, I know you're a very active guy, you're a very physical guy, but I'd rather you take the time and rehab right instead of rushing back, and then I'm looking at you again in a couple of months and we're doing another surgery because you hurt yourself.
Glenn Davis is a very high-level athletic gentleman who unfortunately sustained a bad shoulder injury. And his shoulder separation was one in which we didn't feel that he'd be able to return to his previous functional level without surgery to reconstruct his shoulder. Glenn was a very motivated patient and very enthusiastic, and was excited about the challenge of recovering from the surgery. He did great after the operation, and because of his high motivation level, he was able to recover quite quickly and really ended up returning to a very high level of function much faster than I would have even expected of him.
The only way it could have been any better is if we'd have did it at home.